So, hello, my name is Jonah Michelson, and I had a suffered a jersey finger um, about a month ago playing rugby by grabbing someone's jersey, and I thought because there's not many resources online, I've been had a lot of time and been reading pretty much every resource and scientific paper that there is, and I was inspired by a series on YouTube by Mike Kincaid. Sorry. Yeah, I was inspired by a series because he had a similar injury, but he lacerated his tendon there on his pinky finger cut while gardening, and he made a recovery series because he also found that there wasn't many resources for people that kind of were going through the flexor tendon repair, and so I'll just give some details about what happened. So he lacerated it. I had the jersey finger, which means the tendon came right when your fingers are in a flex position like this, and then there's a strong force that tries to straighten it. So I was grabbing someone's jersey, they were running away. Um, the the tendon rips off of the dip joint, which is the final joint in the pinky or final joint in the finger. And so um, what they did was they had to make an incision here. The t- so I had the injury. Sorry, I had the injury April. Today is May 24th. I had the injury on April 19th, and then I ended up having surgery about 2.5 weeks later on Thursday, May 7th. So it was 2.5 weeks, and um, a lot of the scientific material really strongly recommends that you get surgery for this kind of thing within the first 7 to 10 days because the tendon can retract and scar tissue starts to build up, and then it adheres to the scar tissue, which makes it really difficult to get a lot of range of motion back um, for long term. And it's such a hard thing to operate on because the finger is such a small there's such a small area to operate on, and when the tendon starts sticking to the surgery or starts sticking to the scar tissue, then it becomes really difficult um, to get full range of motion back. It's pretty common to have it on the ring finger. Um, some stuff I've read has said about 75% of these jersey fingers are on the ring finger because if you if you go like this with your hand, the ring finger is the one that goes extends the longest when you're grabbing something. So it's commonly on the ring finger, and I've had so because I had the surgery 2.5 weeks ago, 2.5 weeks after the injury, there was some buildup with scar tissue. So I'm going through the surgical notes. Um, oh, and I'll put that up on the screen. But I had surgery with Dr. Oji Salaya at Toronto Western Hospital Hand Clinic. He runs the hand clinic at Toronto Western Hospital. He's a fantastic surgeon. I was really happy with everything that's gone. I'm about 2 weeks and 2 days post-op from the surgery now. He's also, which kind of surprised me when I first looked it up and looked him up, he's also has a plastic surgery practice, like breast stuff and face stuff and all that kind of thing. Um, but it's very common for hand surgeons to be plastic surgeons because it's such an intricate thing. So don't be weirded out if kind of that was kind of surprised me as well, but that's pretty normal. And he was, he, he did a really great job. And my occupational therapist Sarah, who I see probably once every 5 days, is also really incredible and really helping me. But the surgery was a success. They found the tendon. I'll show you. I'll put up a picture post-op, but I'll just show you here. So they found it retracted where they made that incision there, and then they had to thread it back up to the top there. But I'm not going to touch the finger. But it's not too bad to touch the finger. You just don't want to press it back because that puts a lot of strain on the repaired tendon. Um, but my appointment 2 weeks ago said everything was going really well. The tendon is intact. They thread it back up to where it should be, and they drill into that bone. Um, they drill into that bone uh, back where the tendon should be. And so it's when you see that it's in a bent position like this, that pretty much means the tendon's intact. If I had re-ruptured the tendon, because I'm pretty paranoid about doing that, a lot of the exercises, you need to be doing the exercises to prevent the buildup of scar tissue and to get the tendon moving as early as possible. So I had a plaster cast or whatever, like a strong cast, couldn't touch it at all, and couldn't take it off for 4 or 5 days after the initial surgery on the 7th. And then I've been put into this, which is called a dorsal blocking splint, which I can remove, wash my hand, change the dressing, change the sock and stuff. And I had my stitches removed on the 22nd, 2 days ago. Today's the 24th. And now I have this for 4 more weeks, this dorsal blocking splint, is what they told me. But I might be ahead of schedule and they'll put me in a different type of splint. 4 more weeks, and then I have 10 more weeks after that before I'm clear to kind of get back to more serious stuff, like maybe back to rugby potentially or weightlifting and that kind of thing. Um, so it's a long recovery, but I'm still pretty early, and I don't have much movement in the finger. Uh, but I'm thinking it will get a lot better, hopefully. And like they said, there wasn't much. They didn't see much scar tissue um, build up. Like it wasn't too bad on the finger. You can in the notes. Well, I'll talk about the surgical notes first off. One thing that's one thing that I was surprised to read about was that they performed tenolysis, which I didn't even know before the surgery because they didn't tell me that they would have that might be a possibility. I didn't even know about it. That's essentially just um, trying to remove the tendon and remove some of the scar tissue that the tendon is adhered to. So I guess they had to do that because of the amount of time that had passed from the date of the injury to the surgery. And even though I'm pretty upset with my kind of family doctor, what I should have done was gone to emergency right away. And I went to my family doctor, had to wait for scans, had to wait for the imaging place to send the scans back to the doctor. Then I had to wait for the doctor to refer me to the hand clinic in the hospital. So the process dragged on, and that's kind of a con of the Canadian health system as well. And even though there's a lot of benefits, I didn't have to pay anything. I just walked in, showed my Ontario health card, and got the surgery done and got all the imaging done for free. But I had to wait 2.5 weeks to get surgery, so um, it's kind of pro and con about that. Anyway, I have the most recent notes from the 22nd follow up were showing that I had mild edema, which essentially just means it's a slightly swollen, and I'll put up a picture to compare it to my other ring finger. It's slightly swollen, and they have me doing exercises every 2 hours. They had me initially on just two exercises, just the one that you push down this for 10 seconds as far as you can. This is no risk to re-rupturing the tendon because it's um, putting the passive range of motion. It's no risk as long as you don't push it backwards. If you push it down, it's fine. So you hold that down for 10 seconds, and then you try to push as much as you can back up to the top, which is active rotors. So they had me on that one, and then they had me on half fist scratches, which I don't want to do because you're supposed to warm it. You're supposed to complete that exercise. But then they have me on doing 6 exercises now, every 2 hours, and I'm probably doing 3 to 4 times as much as they recommend because I'm thinking, well, if the only restriction is kind of the pain, as long there's a risk for re-rupture on all the exercises that you do, apparently. Um, but the most recent research suggests that you should the getting range of motion 3 to 5 days after surgery is worth the risk of re-rupturing because what they used to do is put you in a cast for 6 weeks and you wouldn't move it at all, and then they take off the cast and the tendon would be completely intact, but there would be so much scar tissue buildup that uh, you wouldn't be able to get good range of motion with your finger whatsoever. So they've changed their approach to now getting active range of motion as soon as possible. And if you do, there's from the studies I've read, the risk of re-rupture is about 1 in 20, so 5% of patients re-rupture. But if you don't do the exercises, you're just gonna have a stiff finger. That's 100%, right? So you need to walk a line between risking that re-rupture and doing the exercises so you can have a working finger that does everything that you want to do. Um, but that's about it. And it's a frustrating injury, I have to say, because a lot of people like this is what Mike also said, right? In his Mike Kincaid, he also said this, but people are gonna say, oh, it's just a finger, and that it is just a finger, and there's a lot worse stuff that could happen. But I'm a right-handed, I'm right-handed, and it's frustrating to not have your hand work as it normally would, and it probably will never work as it normally would. The study I've read says considers an excellent surgical result for this type of injury for jersey finger at 85% original range of motion, and a good result like 75 to or 70 to 85% range of motion is a good result. So I'm not expecting anymore to have the finger be 100%, but practically it will be able to do almost everything. It just won't. I just won't be able to bend it down to here, or maybe straighten it like that ever. But maybe it'll be like that or like that, and not like this. But so that's frustrating. But there's a lot of things that could be worse than that. And I just want to say as well. So I was on. I really it's important to have a really strong, a good support system because it's really hard to do everything, to do it a lot, like cook and like thankfully I'm living with my parents, so I don't have to cook. I'm 22. I just moved in back because I graduated university, but I don't have to really worry about cooking. I was helped with the schedule. My mom helped me with the schedule of my medications and all that, so it's really helpful to have I'm thankful to have such good help dealing with the injury. And what else was I gonna say? Oh yeah, I've recently just so this has been helping a lot. I think recently you're not supposed I've been keeping it out completely elevated totally almost 24/7, which is pretty uncomfortable when you're trying to sleep. But the purpose of that is to dec limit the swelling in the finger. You're supposed to keep it above your heart. Limit the swelling in the finger and that will prevent the buildup of scar tissue in the finger. So I've been doing that, and I recently this week have, since I've been off of the hydromorphone, I was probably on the hydromorphone, which is the opiate that they prescribed for the pain. I got off that probably about, I would say like 10, 7 to 10 days after the surgery. I was off that, but now just I was after that I've been on just extra strength Tylenol and Advil, and now past 2 days haven't even had the extra strength Advil and Tylenol because it doesn't really hurt anymore. And we've gone back, went for some beers with some friends. So obviously I wasn't drinking or with on the medications, but once you're off that, the I was asking about that because if it was gonna hurt the healing process, I wouldn't have done it. So I asked, and she said, yeah, a couple will be fine as long as you don't, put yourself at risk of falling down and um, potentially re-injuring it. So drinking was fine, and been going on. You're not supposed to get your heart rate up too high because that can also increase the swelling, which could in turn increases the production of scar tissue, the formulation of scar tissue. So been just I'm an extremely active person. Cycling, I was competitive cyclist. Um, Obviously on the rugby team. I'd run, play tennis, play golf, and everything. So I can't do any of that. Can't run or even go on a stationary bike yet. So I've just been going on super long walks. I started that this week, like 3, 4 hour walks, just to try to get some activity and stay in a decent shape, um, which has been helpful for um, just for mental health and uh, everything like that as well. And what else was there? Yeah, so that's pretty much it. And I'll be responding to any questions because, yeah, I thought this might help because I met another guy. I hadn't really met anyone that had this jersey finger or went onto like online forums like Reddit, and not many people were talking about their results, and I wanted to be able to show um, like how the process is coming along so you can have a benchmark for your own healing process. I met a guy in the waiting room 2 days ago who recognized this dorsal blocking splint because it's pretty specific to the injury, and he said, "Oh yeah, I had the same thing playing hockey." He grabbed someone's cage in like a Russell tussle kind of situation or a scrum around the net. Grabbed someone's cage, got jersey finger on his ring finger as well, and he didn't have surgery till 3.5 weeks because this is it's a commonly misdiagnosed injury because you like I did. I also thought it was just jammed at the beginning, which prevented me from going to the emergency room. I just thought it was a regular jammed finger, which I've had 1,000 times. Um, he had he had a lot more scarring, and that comes down to like um, just it's sometimes the luck of the draw. Some people just develop up scar tissue quicker than others. So I unfortunately I think that I'll probably get some more range of motion, but it's helpful to talk with people that or see other people that are going through the same thing and benchmark your own progress on that. Um, but yeah, I was thought it would be good to uh, show talk about this, and I'll keep updating. Probably do a 1 month, 2 month, or maybe 6 weeks. Definitely 12 weeks. Yeah, maybe 2 months and then 3 months. But it's getting better slowly and surely, I think. And yeah,